So how are you going to know whether your patient's calcium levels are high or low? Could be signs and symptoms, but typically it's going to be your lab values, whether in the morning or throughout the day. But on your lab values, you might see two types of calcium. There's calcium, and then there's ionized calcium. So which one's the right one? Well, calcium likes to bind to something called protein in the blood. And once these two bind, calcium is useless. His mom, the parathyroid hormone, not going to get him to do anything. Sticking with our example about calcium being a teenager, I want you to think of calcium and protein as a teenager picking up a video game controller.
Calcium, I need your help. The heart and nerves need us.
So much like many teenagers, once they get that controller in their hand, it's very hard to get them to do almost anything. So actually, 40% of all the calcium floating in your bloodstream is bound to protein, meaning that it is inactive. The equipment in the lab that they test the calcium with just takes the total number of calcium. It does not differentiate between whether it is active form or non-active form. And it can be a little misleading because let's say your calcium levels are within normal range, but your patient's protein levels are low. That number of calcium you're seeing is probably actually higher because there's less protein, meaning less binding, and vice versa. More protein, more binding, the number of calcium is probably actually lower than you're seeing on the screen. But if you want a true calcium, you need to have the doctor order ionized calcium. Ionized calcium is the free-floating calcium, that other 60% that's not bound to protein. That is the true number of your patient's calcium levels because that is the one that tells you how much calcium is ready to be used, how much is in the blood ready to go to be used by the body's functions. Before you determine whether your patient is hyper or hypocalcemic, you need to understand which level are you looking at. And if it is not an ionized, which is the true calcium level, then what is your patient's protein level? If it is high, the calcium is probably lower than what you're seeing. And if it is low, the calcium is probably higher than what you're seeing on your current lab result.